My name is David Knapp, and I am with the Education, Workforce, and Development Branch of the Kentucky Department for Public Health. Today, we begin our journey of understanding the Council on Linkage's core competencies for public health professionals. And to guide us, I welcome Ron Bielek, the President of the Public Health Foundation. Ron, I want to first thank you for joining us today. And this question to get us started: what are the core competencies for public health professionals?
David, let me begin by thanking you for this opportunity to help people better understand what the core competencies are and their importance to the public health field. The core competencies for public health professionals are a consensus set of desired skills for the practice of public health in any setting. They were developed by and for public health practitioners, researchers, educators, and trainers. Over 2 decades ago, the Council on Linkages between academia and public health practice, which is comprised of leaders from 20 national public health practice and academic organizations, developed the core competencies. Since that time, the Council on Linkages has periodically reviewed and revised the core competencies to assure that they reflect changes to the practice of public health. Over the years, thousands of comments from public health professionals have been received and used each time the core competencies have been revised. Comments have come from educators, researchers, and practitioners, spanning individuals who are just beginning their public health careers to those who have been in the field for decades. Hearing from and being responsive to the public health community has been key to the wide use of the core competencies.
Ron, why do they matter to public health?
This is a great question, and one that I always enjoy answering, because the core competencies are having an enormous impact on public health practice and training. The core competencies help public health professionals at all career levels understand what skills are needed for practicing public health. They also help educators and trainers know what is important to teach. Today, we see that the core competencies are being used by more than half of all state health departments and nearly a third of all local health departments. One relatively new use of the core competencies has been by health departments applying for accreditation through FAB, the Public Health Accreditation Board. The majority of health departments accredited thus far have used the core competencies in their workforce development plans. These plans and the use of nationally adopted public health core competencies are required by FAB for accreditation. In addition to the core competencies being written into public health accreditation standards, they also are written into 3 Healthy People 2020 objectives, Institute of Medicine reports and recommendations, and many state and local health department improvement plans. The core competencies are indeed being used to improve individual and organization performance, which are key to improving the health of communities.
How do the core competencies benefit providers of public health training?
As a former faculty member at the Johns Hopkins School of Public Health, one of my greatest motivators was seeing my students go on to successful careers after they graduated. I learned that as an educator, one of my key roles was to help my students develop skills they needed to be successful in their public health careers. This means that I needed to help my students develop skills in areas identified by the core competencies. Today, in my role as president of the Public Health Foundation, I see the importance of the core competencies for continuing education. Most public health professionals do not have public health degrees. The core competencies are used by the Public Health Foundation and can be used by any provider of public health training to focus on building skills that public health professionals need to perform well, to strengthen their agencies, and to improve the public's health. The core competencies for public health professionals is one of the most valuable tools educators and trainers can use when developing and providing training that is designed to meet the needs of our current and future public health workforce.
Ron, how do the core competencies support services delivered by health departments?
David, what has been exciting to see is the dynamic increase in use of the core competencies by health departments for job descriptions, performance reviews, individual training plans, and agency-wide workforce development plans. Health departments also are using the core competencies to assess and address their training needs of their workforce. In the past, health departments reported that they were aware of the core competencies and used them in discussions about workforce needs, but they hadn't really integrated into the everyday practice of these agencies. We are now seeing the core competencies being embraced by health departments as an important tool for assuring that they have a highly skilled public health workforce, a workforce that is the essential ingredient for achieving high-performing health departments.
Ron, just one last question. Where can one find help and/or more information?
There are a variety of ways to learn more about the core competencies and to find help in using them. The Public Health Foundation, as staff to the Council on Linkages between Academia and Public Health Practice, has many web pages dedicated to the core competencies, which can be easily accessed by going to www.phf.org/programs/core competencies. On these web pages, you will find tools to help practitioners and trainers use the core competencies, examples of how the core competencies are already being used, and contact information for questions about the core competencies. We also have an easy-to-remember email address that can be used, competencies@phf.org. We welcome continued feedback on the core competencies, both good and bad, from public health practitioners, researchers, trainers, and educators. We want to hear suggestions for improving the core competencies and how the Public Health Foundation can help with their use. We also are here to answer specific questions that individuals have about the core competencies and ways they can be used. David, thank you again for this opportunity to help get the word out about the core competencies for public health professionals. The core competencies truly are an important tool as we work to address current workforce needs and build the public health workforce for the future.
Ron, this has been very helpful, and I have a better understanding of what these competencies are about, and I thank you for joining us today. And I thank you for joining us today as we take our first steps in our journey of understanding the Council on Linkage's core competencies for public health professionals.